Whey protein. Welcome to this space where we will delve into the findings of the review investigating the health implications of whey protein consumption, a narrative review of risks, adverse effects, and associated health issues by Kava et al. 2024. We'll talk in plain language about what whey protein is, why it's become so popular, what proven benefits it offers, and what potential risks we've identified based on the most recent studies. Whey protein is the liquid separated from the curd when making cheese. To convert it into a supplement, this liquid is dried and purified, resulting in different forms: concentrates with 25-85% protein, isolates with 90-95% protein and minimal traces of lactose and fat, and hydrolysates, which are processed to further facilitate digestion. The richness of essential amino acids and especially the high proportion of leucine make whey protein an ideal agent for boosting muscle protein synthesis after exercise. In the sports world, there is a consensus that taking 20-30 g of whey before or after training helps improve recovery and, in combination with strength training, increases muscle mass and strength. However, trials show variability. While some athletes notice significant improvements, others barely see a small ergogenic effect. Everything depends on the dose, timing, type of whey, and the context of the physical activity. But, alongside its popularity, questions arose about the safety of its prolonged use, especially when used daily and in high doses, without medical supervision. Can the liver tolerate an excess of amino acids? Is there a risk to kidney function? What happens to the gut microbiota and, interestingly, to the skin, given that several users report acne breakouts? These are the questions that motivated Kava et al. To analyze 21 studies, 12 in humans, 8 in animals, and 1 in vitro to shed light on this conversation. Throughout this podcast we will discover 1. The most solid benefits. It helps maintain and increase muscle mass, especially valuable in older adults to prevent sarcopenia. Positive effects on bone function and some immunological and metabolic markers. Possible improvements in the intestinal microbiome, increasing beneficial bacteria and production of short-chain fatty acids. 2. Risks and adverse effects. Mild to moderate alterations in liver, ALT/AST, and kidney, creatinine, calcium excretion, urinary pH, markers, especially in sedentary subjects or those with previous pathologies. Consistent association with increased acne in adolescents and athletes, which resolved after discontinuation of the supplement. Changes in the composition of the microbiota that in certain cases could favor less desirable bacterial groups. Emotional variations in some users, such as a slight increase in irritability or expression of anger, although the evidence is weaker. 3. A SWOT analysis of these findings, to help health professionals and consumers assess when it is appropriate and when it is worth compromising precautions. Strengths, robust evidence of muscle and bone improvement, availability of clinical studies. Opportunities, new combination formulas, vitamin D, calcium, leucine, applications in clinical nutrition and geriatrics. Weaknesses, scarcity of human trials lasting more than 2 years, heterogeneity of designs, and exclusion of studies with positive results. Threats, possible liver or kidney damage in vulnerable populations, risk of acne, and adverse changes in microbiota. In this first episode, we established an overview of whey protein, what it is, why it's consumed, and the review methodology. In the next episode, we'll delve deeper into each of the major topics: liver and kidney function, acne, microbiota, mood, and bone health. Podcast Part 2, Potential Risks: Liver and Kidney Function, Acne, and Gut Microbiota. Let's begin by exploring one of the most concerning topics, the impact of long-term whey protein consumption on the liver and kidneys. In the clinical studies reviewed, most participants were healthy, physically active adults, which limits the extrapolation of results to those who lead a more sedentary lifestyle or already have a liver or kidney condition. Even so, some studies reported mild, transient elevations in liver enzymes ALT and AST after daily supplementation of 20-30 grams of whey for 12 months or more. These elevations rarely exceeded the clinical alarm range, and in many cases, they returned to normal even with continued intake. For this reason, experts agree that, in individuals without pre-existing illnesses and at moderate doses, whey protein does not compromise liver health. However, in people with non-alcoholic fatty liver disease, hepatitis, or a history of alcohol abuse, periodic monitoring at least quarterly of liver function tests is recommended to rule out accumulations of metabolites that could overload detoxification mechanisms. Regarding the kidneys, the main concern lies in the potential overload of urea and creatinine generated by an excess of high biological value amino acids. The kidneys must excrete excess nitrogen, and it is hypothesized that this could increase intraglomerular pressure or alter urinary pH. However, trials lasting more than 2 years have not documented a significant impairment of glomerular filtration rate or the excretion of biomarkers such as urinary albumin. However, in people with chronic kidney disease or a creatinine clearance below 60 ml/min, it is advisable to limit total protein intake and, if whey is included, to limit protein intake. Protein, do so under medical supervision, adjusting the dose to 0.81.0 g of protein per kilogram of body weight per day instead of the 1.2-1.6 g/kg recommended for healthy athletes. Let's now move on to the surprising link between whey and acne. Many athletes, especially young ones, report an increase in acne-like lesions in the initial phase of supplementation. The main hypothesis is that the elevation in insulin and IGF-1-like growth factor levels induced by leucine and other amino acids in whey stimulates sebum production in the sebaceous glands. When combined with skin bacteria, this sebum clogs follicles and causes breakouts. Interestingly, in most cases, acne intensity tends to decrease after the first 8 to 12 weeks, suggesting some hormonal adaptation or regulation of the IGF-1 axis. Medically, it has been shown that by temporarily discontinuing the supplement for 4 to 6 weeks and then restarting it at slightly lower doses, the problem can be mitigated without completely losing the benefits of whey. Finally, in this episode, let's address the effects on the gut microbiota. Whey contains bioactive peptides that act as prebiotics, promoting the growth of beneficial bacteria such as Bifidobacterium and Lactobacillus. Some studies have shown an increase in the production of short-chain fatty acids butyrate, propionate, and acetate key compounds for colon health and modulation of the inflammatory response. This could translate into reduced intestinal permeability and a strengthening of the immune barrier. However, it's not all positive. A decrease in genera such as Rosebaria and Faecalibacterium has been observed in certain high-dose protocols, which could disrupt microbial balance if the diet doesn't include sufficient prebiotic fibers. Therefore, a sensible strategy is to accompany whey consumption with fruits, vegetables, and whole grains to ensure an adequate supply of fermentable substrates that support bacterial diversity. In summary, the evidence suggests that, for most healthy people, daily consumption of whey protein intake for 2 years or more does not pose a serious risk to the liver or kidneys and can be easily managed through periodic monitoring and dosage adjustments. Acne, while bothersome, is usually transient and manageable with simple dietary and supplementation strategies. As for the microbiota, serum provides benefits by stimulating beneficial bacteria, but it is advisable to maintain a high-fiber diet to preserve intestinal diversity. In our next episode, we'll delve into the muscle and bone benefits of whey protein and provide a full SWOT analysis of the review's findings. Don't miss it. Podcast Part 3, Muscle, Bone, and Immune Benefits of Whey Protein. We continue our tour by delving into the most notable benefits of prolonged supplementation with whey protein. Protein. In this section, we will discuss how it contributes to muscle health, its impact on bone mass, and its role in the immune system, based on the findings of the review by Cava et al. And related clinical studies. 1. Synthesis and maintenance of muscle. Mass whey protein is valued primarily for its ability to stimulate muscle protein synthesis, MPS. This is primarily due to its high proportion of branched-chain amino acids, BCAAs, especially leucine, which acts as a direct anabolic signal in the muscle. In long-term trials, up to 24 months, older adults who supplement with 20-30 g of whey per day in combination with resistance exercise have been shown to not only maintain muscle mass but also increase their maximum strength in leg press and biceps curl exercises by up to 5%. This effect is particularly valuable for preventing age-related sarcopenia, since after age 60, the progressive decrease in muscle mass increases the risk of falls and loss of autonomy. 2. Bone health and density. In addition to its role in muscle, whey protein has been evaluated as a contributor to bone health. In studies of postmenopausal women, a daily intake of 25 grams of whey protein maintained stable levels of bone mineral density in the lumbar spine and femur for 24 months, while the placebo group recorded an average annual decline of 1%. This protective effect appears to be mediated by a slight improvement in bone remodeling markers, reduced alkaline phosphatase and increased osteocalcin, and by the provision of peptides that positively modulate osteoblast activity. Although it does not replace vitamin D or calcium, whey protein strengthens the bone matrix when combined with an exercise plan that includes impact loading. 3. Immune function and overall health. Another fascinating aspect is the influence of whey protein in the immune system. Whey contains various bioactive peptides such as lactoferrin, immunoglobulin G, IgG, and alpha-lactoalbumin, compounds that have been shown to improve barrier function and resistance to infection. In a cohort study of office workers who consumed 15 grams of whey daily concentrate for 30 months, there was a 20% decrease in the number of episodes of mild respiratory infections, colds, tonsillitis, compared to a control group. In addition, an increase in salivary IgA levels, a mucosal defense marker, was detected, suggesting that the serum strengthens the first line of immunity in the mouth and throat. 4. Lipid and cardiometabolic metabolism. Additionally, the review highlights beneficial effects on the lipid profile of overweight adults. Supplementation with 25 grams of whey protein a day for 2 years reduced LDL, bad, cholesterol levels by an average of 8% and total cholesterol by 5%. Although these changes are modest, in conjunction with diet and exercise, they can translate into a significant reduction in long-term cardiovascular risk. This effect is attributed to peptides that inhibit angiotensin-converting enzyme, ACE, and to indirect improvements in insulin sensitivity. 5. Emotional and cognitive well-being. Finally, whey protein also impacts the neurochemical axis. Alpha-lactoalbumin has been identified as promoting the availability of tryptophan in the brain, a precursor to serotonin, a key neurotransmitter in mood regulation. In animal models, this peptide has been shown to reduce anxious behavior and improve sleep quality. Although human evidence is preliminary, some whey consumers report a slight improvement in mood and a sense of well-being, especially if consumed in the afternoon, away from times of peak physical activity. In short, whey protein is not just a musculoskeletal supplement, but offers a broad spectrum of benefits. It strengthens muscle mass and bone density, supports immune function, and can contribute to a healthier lipid profile, in addition to positively influencing emotional well-being. In the next episode, we'll conclude this analysis with a SWOT analysis of the document's contents and practical recommendations for integrating whey protein. Protein safely and effectively into your daily routine. See you in Part 4. Podcast Part 4, SWOT analysis and practical recommendations for using whey protein. We've reached the end of our series, where we'll summarize what we learned through a SWOT analysis of the CAVA ETAL review and offer concrete recommendations for those who want to incorporate whey protein safely and effectively into your daily routine. Strengths. The review shows that whey protein has robust evidence of its benefits on muscle mass and strength. Thanks to its rich profile of essential amino acids, and especially leucine, it promotes protein synthesis more effectively than other protein sources. Furthermore, long-term trials in older adults demonstrate its ability to prevent aging-associated muscle loss, with improvements of up to 5% in leg and arm strength after resistance exercise. Another strong point is its contribution of bioactive peptides such as lactoferrin and alpha-lactalbumin that strengthen immune function, reduce episodes of respiratory infections, and can even positively modulate mood by increasing the availability of tryptophan in the nervous system. Finally, there is support that daily doses of 20-30 g of whey, in combination with exercise and a balanced diet, help maintain bone density, which represents a double benefit in populations at risk of fractures. Opportunities. The supplement market presents a growing demand for advanced formulas that combine whey protein with micronutrients such as vitamin D, calcium, and magnesium, as well as other functional ingredients collagen peptides, or even probiotics to enhance musculoskeletal and digestive health. Future research could explore personalized protocols based on age, sex, and physical activity level, optimizing doses and timing of intake. Furthermore, emerging evidence on the impact of whey protein on the digestive system is emerging. Protein in the microbiota and the modulation of the gut-brain axis opens the door to the development of supplements targeting mental health, recovery from illness, and the prevention of sarcopenia in clinical settings. Weaknesses. Despite its popularity, whey protein has methodological limitations in the literature. There is a paucity of controlled clinical trials exceeding 2 years in humans, and many studies combine supplementation with various exercise protocols, making it difficult to isolate the exclusive effect of whey. The heterogeneity of the samples, athletes, older adults, sedentary individuals, and the variability in supplement quality, concentrates versus isolates versus hydrolysates, also complicate the comparability of results. Furthermore, information on optimal doses for specific populations and on the impact of intake at different times, morning versus evening, is insufficient, leaving a gap in defining universally valid recommendations. Threats in populations with pre-existing liver or kidney disease. Whey consumption unsupervised protein intake could aggravate enzyme elevations or overload glomerular filtration, especially when combined with high protein intakes from other sources. Likewise, the appearance of acne in adolescents and young adults, associated with the stimulation of IGF-1, can deter those who value their dermatological health. At the public health level, the proliferation of supplements of dubious quality contaminated with heavy metals or adulterated with stimulants and the lack of strict regulation in some markets, including online stores, put consumers who purchase uncertified products at risk. Finally, the tendency to consider whey protein as a miracle solution can lead to neglecting the importance of a varied diet and healthy lifestyle habits, which reduces adherence to a comprehensive approach to well-being. Practical recommendations. 1. Medical evaluation. Before starting long-term supplementation, especially if you have a history of kidney or liver disease or metabolic imbalances, consult a healthcare professional. A basic liver, ALT, AST, and kidney, creatinine, filtration rate, function check will help rule out risks. 2. Choosing the right formula. Choose products from trusted brands, ideally those with quality certifications, NSF, Informed Sport, that clearly specify the protein content, whey type, concentrate versus isolate versus hydrolysate, and the absence of contaminants. If you're lactose intolerant, choose isolates or hydrolysates that are low in carbohydrates and fat. 3. Dosage and timing. To maximize muscle protein synthesis, 20-30 g of whey protein after resistance training is an adequate dose. On rest days, the intake can be divided into 2 doses, morning and afternoon, to maintain a consistent supply of amino acids. For monitoring and adjustments, Have liver and kidney markers checked every 6-12 months if you consume whey daily. If you observe persistent ALT/AST elevations or symptoms such as unexplained fatigue, consider reducing your dose or alternating rest periods while supplementing. 5. Acne prevention. If you notice breakouts on your face or back after starting the supplement, try stopping for 4 weeks and restarting at a slightly lower dose, 15-20 g. Maintain proper hydration and gentle facial hygiene to help control sebum production. 6. Microbiota support. Combine whey protein with a fiber-rich diet, legumes, fruits, vegetables, whole grains, and, if appropriate, incorporate a quality commercial prebiotic or probiotic to maintain favorable bacterial diversity. 7. Integration into a holistic approach. Remember that whey protein is a supplement, not a replacement for a balanced diet. Prioritize fresh, varied foods and minimize the consumption of ultra-processed foods. Combine supplementation with regular exercise, good rest, and stress management for sustained results. With this SWOT analysis and these recommendations, we conclude our analysis of the risks and benefits of whey protein according to the most recent review. We hope this information helps you make informed decisions and get the most out of this supplement on your path to a healthy and active lifestyle. Thanks for listening, and see you next time.